Okay. This next patient is a patient who is status post head and neck cancer with chemo and radiation. You can see that there is a very thickened epiglottis, thick tissues throughout the throat. There's trouble getting the consistencies to go through the pharynx because of the swelling and the thickness of the tissues. And you can see that there's trace amounts of penetration. And I'm asking this patient to cough. If you could hear the video, I'm asking her to cough these things out of her airway. So she really didn't have a great sensation when they hit her vocal cords, probably because they're a little bit swollen as well. But you can see that she's protecting her airway fairly well. She already has a PEG tube, so this patient has been NPO during her most difficult time of treatment. We wanted to be sure that she got enough nutrition, so she was already recommended to have a PEG tube placed, but now she's ready to get back to eating, and it's several weeks after treatment, and it's really a good thing to go ahead and start this patient eating something so that she doesn't get into disc atrophy, which her muscles would atrophy, as well as having this swelling that hopefully will go down a little bit as she gets further out of her treatment. Usually it's a 7-week protocol that they do for radiation. It can be shorter or longer depending on how significant the cancer is and where it's located. But for this particular patient, it was base of tongue. So you can see that they radiated all the area right around that. So that's why the tissues are so swollen. And she's penetrating and she's coughing. You know, my experience with these patients is that they're not going to have a huge amount of PO intake, so you don't want to be in a rush to pull the PEG tube out. What you want to do is get them eating small amounts, more and more each day, until they get a little more comfortable with eating and swallowing. Typically they've had their swallow knocked out during about the 4th week of radiation, so they're not even managing their saliva at that point. So it's very frightening for them when they do try to swallow and they realize they can't do it for a while, to get them back to eating. So keeping a food diary, and you can see that huge chunk is lodged there. That's a choking hazard. With the swelling that she has going on. So probably would avoid solids due to choking, would start with some pureed and thin liquids, would have her keep a journal of what she's eating every day. Talk about what foods occur naturally as pureeds like hummus or baba ganoush or yogurt, things like that, so that this patient feels like that she's getting back to a more normal state. She's a very young lady. This is somebody who's in her 60s. Who still, has plans to go home from this facility within a couple of weeks, is just trying to build up a little strength, obviously got knocked back, had some pneumonia during her radiation treatment, so that was also hard for her to recover from, so she's just generally weak. You could certainly do some laryngeal elevation exercises with this patient, definitely keep the PEG tube in place, have them taking sips of water all day long, even though they're having some penetrations and little trace aspirations. You want to get this patient back to swallowing more normally as quickly as possible. I did encourage her to chew better on this trial. I felt like she just didn't chew as well, and it scared her a little bit when she tried to swallow. So I gave her a little liquid to wash down. I think it was a cracker. So you could talk about what things are appropriate to practice chewing that might go through a little more clearly, and you could see the aspiration there, and I'm telling her to cough it out. We're trying some supraglottic swallows, but not real successful with getting better closure. She's having to fight so hard just to push things through the pharynx. So this is a case where PEG tube is very appropriate. You certainly want to, get those PEG tubes in patients who are going to go through chemo and radiation sooner rather than later, especially if they're really cognizant. And the goal is to have them recover, and that was certainly the prognosis here, was that she was going to get the chemo radiation, have a recovery period, and then go back home, hopefully on a more normal type of diet. I have seen where the swallow is completely gone after chemo and radiation, so in her case she's doing a good job of protecting her airway for the most part. I mean, it's certainly not 100%, and there's some treatment goals that can really be established here, and especially for the patient to see this and understand what's occurring. But certainly in no way would I like to see this patient have a PEG and be NPO at this point. In the past, that would probably be what was recommended because of the penetrations and aspirations. She's high risk, so we shouldn't feed her. And now we've learned that that's absolutely not true. In this case, it's probably better to get this patient back to eating as quickly as possible.